just was out of it. And it's really scary when you look back and think, okay, like I can't believe that was like 3 or 4 days of me just sleeping me out of it when I have a family to take care of. I have a business to run.
Well, a Midland's mother, one of thousands who got the flu this winter, and experts say cases are rising. The South Carolina Department of Public Health's recent Flu Watch report tells WIS that 356 people were hospitalized and 3 people died in just 1 week here in South Carolina.
WIS reporter Naomi Popa joins us. And Naomi, the CDC says the state of South Carolina is experiencing very high levels at this time of the flu. But doctors are telling you that it's actually pretty common.
That's right. It actually is. And those levels are high right now because that's that peak that South Carolina is seeing during that time of year. Doctors say that usually happens right around that time, first 2 weeks of January. But it's not just the people with the flu that one doctor tells me is contributing to full waiting rooms. It's also other respiratory illnesses as well.
I've never seen it that full. It's not all flu, but there's a lot of flu and there's a lot of respiratory viruses.
Dr. Helmut Albrecht, an infectious disease specialist, says flu cases typically increase before the holidays and immediately afterward. South Carolina is no exception. Latest reports show more than 10,000 confirmed flu tests this season. But that number could be much higher, as not everyone gets a flu test. By the end of the season, doctors expect that number to double, if not triple. Mom, Alexandria Newcomb, tells me this year hit her family especially hard.
I think that's what's nuts too, is because right around Christmas it started with me with the flu, then it's her with RSV. So, it's like the whole family is just, they were falling ill from all different types of things.
RSV, walking pneumonia, the flu, and norovirus are among the many illnesses going around in South Carolina. Newcomb, who had the flu, says she was worn out for 4 days, in and out of sleep as she slowly recovered. In the meantime, her 13-year-old daughter caught something else.
She's having trouble breathing, so we ended up having to go to the hospital. And then when they came and said RSV, I was shocked because I thought that was only infants or, elderly people. What we might have thought was just the common cough for my daughter was RSV, and it was really serious and she couldn't breathe.
Dr. Albrecht says while the flu and other illnesses can be difficult for anybody, it's especially hard for those who are immunocompromised, the elderly, and even young children.
A lot of people are fatigued of precautionary measures, not being social, not getting vaccinated. And if you can't afford to get these things, come up with a plan that you don't get exposed to.
And Judy, Greg, doctors, of course, are urging those to wash their hands with warm water and soap. To be mindful, don't touch others. Keep your hands free from your face, something I find myself doing all the time.
I tell my boys all the time, I'm like, don't touch things.
Yes. And then one other thing, hand sanitizer. A common, protocol or something that you like to use to prevent the spread of germs is not good for the norovirus, is not that effective. Something I mentioned in that story, so keep that in mind. And for more information on how you keep you and your family safe tonight, visit this story on our website at wistv.com.
And you know what? I know even when people do wash their hands, they think they're doing a great job, but you got to scrub and get under your nails. And it's always remind my boys, sing the happy birthday song or your ABCs twice. And then we'll wash all the germs away. Naomi, great reminders. Thank you so much.
All right. Let's head over to Chief Meteorologist